What's up, party people? You thought we were done studying? Hell no, we got more diseases to talk about. Next, we're going to talk about diabetes insipidus and the other one, SIADH, symptom of inappropriate anti-diuretic hormone. Bing, 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 bing. Yeah, but before we talk about that, we really need to talk about some of our major players in this game. There's going to be some key terms we need to understand before we can really get to, I guess the rest of it. First of all, what is ADH? What's urine osmolality? And what is urine specific gravity? Because those two conditions are going to have opposite manifestations, and it makes a lot more sense if you understand kind of what the hell's going on. But first of all, let's talk about ADH. Turn around. Anti-diuretic hormone. First of all, where is it created? Well, it's created in the hypothalamus, and it's excreted by the posterior pituitary gland. You know, the one that looks like a nutsack. That's how I remember it. As with pretty much all of the hormones in the body, it's a negative feedback loop. You know, the brain is responding to what's in the body, and the body is responding to what the brain tells it to do, and so on and so forth. So we have the hypothalamus creating ADH, posterior pituitary is excreting ADH, and the kidneys are basically being told what to do, whether to hold on to water or excrete water. ADH is basically the code that tells the kidneys what they need to do to keep you from being dead. Another name for ADH you may have heard is vasopressin. Important, but probably not going to be on the test, but maybe on Jeopardy someday. So, dang, it's not turning around when I tell it to. Okay, if there's a high amount of ADH, the kidneys will keep the water, and therefore the urine becomes more concentrated. I have to do some mental gymnastics in my brain because you think about diuretics, that makes you pee more. So if there's something that's anti-diuretic, it's gonna stop the peeing. So if there's a lot of stop the peeingness, sounds dangerously close to penis. If there's a lot of that thing that stops peeing, you won't be peeing as much, and therefore your urine is going to be more concentrated. We all know what concentrated urine is, right? It looks like pee versus looking real watery, so keep that in mind. On the flip side, if there is a low amount of ADH, well, the kidneys are going to do what they're told, and they're going to excrete a lot of water. And because a lot of water is getting flushed out with it, the urine's not going to be as concentrated. Again, if ADH is the thing that stops the peeing, if there's not as much of it, there's nothing to stop it. So it's going to be more pee coming out. Lots of peeingness. And of course, we're not done talking about vocabulary. That's a nice transition to urine osmolality, which is a fancy way of saying the concentration of dissolved particles. Osmolality in general can just be like serum, like what's in the blood. So if there's a lot of particles in the blood, you're going to end up having a lot of particles in the urine. I mean, theoretically. And we have another player here, urine-specific gravity, which is just a fancy way of saying the density of urine compared to the density of water. So it kind of makes sense. Something's dense, gravity's gonna do more to it, right? I mean, I sure know when I fall down, it seems a lot more extreme than when a 20-pound kid falls down. So I did some color coding here to try to make it a little easier. Basically, we're going to talk about how urine-specific gravity and urine osmolality, whether that be high or low, how that affects what happens in the kidneys and how it affects the ADH. So I color-coded, let's start with urine osmolality. Color-coded it blue. So for now, ignore the green. So if we have a high urine osmolality, a high concentration of particles, therefore we're going to have a low concentration of water. What does that mean for ADH in the kidneys? It means high ADH, kidneys will keep the water, and urine will end up being more concentrated when it comes out. On the flip side, if the urine osmolality is low, there's a low concentration of particles, and there's going to be a high concentration of water by comparison. So what will happen? There'll be a low ADH, meaning the kidney will excrete a lot more water, and the urine that comes out will be less concentrated, it'll be more watery. Now, looking at the color-coded green urine-specific gravity, again, density of urine compared to the density of water. If there's a high urine-specific gravity, that means the urine is highly concentrated and there's not as much water in it. What will that look like? Boom, high ADH. The kidney will keep the water, urine will be more concentrated. Because if you think about it, the body is trying to balance out the particles and the water. So if there's a lot of shit in your body, a lot of particles, the body's thinking, oh, we better keep some of this water, better keep it in our bodies. And we better flush out some of the other shit. So that's why the urine's more concentrated. If there's a low urine-specific gravity, low concentration of urine compared to the concentration of water, we're going to see a low ADH. The kidneys are going to excrete more water, the urine will be less concentrated. Again, there's not as many particles in there, so the body's going to think, well, I guess we better get rid of some of this excess water. So, boom. Water comes out, less concentrated because that stuff is staying in the body. The main thing to remember here is all of these line up beautifully for the purposes of what we're learning here. High USG, high osmo, high ADH. On the flip side, if there's low USG, there's low osmo, low ADH. It lines up beautifully. Don't overthink it. Just think of it as the body is trying to keep everything in check. And guess what? Sometimes it doesn't. Let's start by talking about diabetes insipidus. We remember that DI equals dry inside. So, appropriately, we're going to have low ADH levels. This can happen for a variety of reasons, but basically a lot of times we see it with some sort of a brain injury, head trauma, that sort of a dealio. Low ADH. So because of that, again, what happens over here? Kidney excretes water. Urine is less concentrated. So a lot more water/pee is coming out. We got polyuria, but it's very dilute urine because of that low ADH. There's not that stop that should be saying, hey, we don't need to pee that much, isn't there. So all that water's coming out. And we're going to be real thirsty. Real thirsty. If all the water's coming out, guess what stays in? The particles. So we're going to have high levels of sodium. Urine osmolality and urine-specific gravity are down. Again, we see that. We see that over here. Low and low. It makes sense. And the patient's going to be at risk for hypovolemic shock, which makes sense. They're just peeing the shit out of everything. All that pee's coming out. Guess what? Fluid volume deficit. On the flip side, we have SIADH, symptom of inappropriate antidiuretic hormone, otherwise called soaked inside. So we're going to have a lot of the opposite manifestations. Just remember the number one symptom you're going to see in patients with SIADH is a headache. Ouchie. So we're going to see high ADH. Guess what happens? Boom. The kidney is going to keep that water. And guess what we're going to see? We're going to see high USG, high osmo. Highly concentrated urine, highly concentrated particles by comparison. So there's going to be retention of fluid, but it's not going to cause edema because that fluid is actually in the blood. Again, the body's trying to reach equilibrium. It's trying to adjust to something here. And we're going to see dilutional hyponatremia. Basically, it's going to seem like the sodium levels are low. They're not really low. They're just low in comparison to how much water is in the body. So again, with all that extra water, we're going to see a high urine osmolality. We're going to see a high urine-specific gravity. We're going to have low to normal sodium levels. Guess what? You're at risk for seizures. Seizure precautions, yo.